Did you know that 13 to 20% of the children living in the United States deals with some type of mental health diagnosis? And that 7.1% or 4.4 million children are suffering with anxiety. And that's before all of this COVID-19 even started. So let's talk about how to work with and interact with and help our children who are dealing with this. Hi, my name is Dr. Ann-Louise, and I'm the president and owner of A New Day Pediatric Psychology in San Antonio, Texas. I'm a pediatric psychologist and a parent coach. So I wanted to take a few minutes to discuss these things with you so that you better understand your children, that it helps to deal with your frustration that you experience when working with them and talking to them, and that you can help ease their fears. So let's start with anxiety. Anxiety is something that is experienced from all aspects of someone's being. We're looking at physical, behavioral, emotional, and mental states. The cognitive. So let's talk about that somewhere. So physical signs and symptoms of anxiety would be things like heart racing, blood pressure rising, sweaty hands, shaky limbs, feeling ill, nauseous, dizziness, complaints of backaches, headaches, and stomach aches. In more than 85% of cases of children with irritable bowel syndrome, diarrhea, constipation, nausea, or even stomach pain, most of the times the culprit is anxiety. Kids tend to report anxiety in 3 of their body systems, typically the GI or the stomach, neurological with the head, and the back. The other part of anxiety is the behavioral stuff. And these are things that we see like isolation. These are things that are observable. Poor eye contact, avoidance, procrastinating, indecision, being indecisive. Then we have the emotional signs of anxiety, and that's the tearfulness, the irritability, being easily agitated and sad, angry, feeling depressed and overwhelmed. And then we have the cognitive signs of anxiety, and these are racing thoughts, foggy brain, forgetfulness, absent-mindedness, even inattention. Anxiety and ADHD, by the way, often look very similar because someone who's very anxious may look inattentive. Because if someone is speaking to you and you're feeling really nervous and you're in your thoughts, you're not really going to pay attention to what they're saying, and they're going to look like they're an ADHD type kid, but they're not. So that is one diagnosis that looks really similar to ADHD. The key component about anxiety is that avoidance feeds fear and anxiety. So if someone is feeling anxious, they tend to avoid. The problem with that, though, is that avoidance makes it worse. Because if you're afraid of something and you keep avoiding it, what you're doing is you're just reinforcing the fear. So then you're like, well, how do you get through it? You face it. The problem is if you're afraid of it, what the heck are you going to do facing it? There's no way you want to do that. But fear is the emotional response to a real or perceived imminent threat. So if you think something scary is going to happen, mom's going to be putting me to bed in a dark room, or, what if I get sick? Or what if we run out of toilet paper? If you're so afraid of these things, maybe they will never happen. Maybe it's not even a real threat, but your brain is saying, hunker down, gear up for a disaster. So then you're constantly scanning your environment. Your ears are peaked listening for disaster, and you're catastrophizing. You're catastrophizing all kinds of events, and you're creating the worst case scenario. The other thing is anxiety is a little bit different than just regular old fear. Anxiety is the anticipation of that threat. So maybe you're fearful of these things happening, but the anxiety really prepares you for that. So all of that gets what they call ruminated in the brain. You continue to repeat it and cycle through it, and goes over and over and over again, where you keep playing out these worst case scenarios, and then you have full-blown anxiety, which is where a lot of the panic attacks come in. Because now you're hyperventilating, you feel like you're going to pass out, you maybe throw up, your heart's racing, you can't sleep, you're having nightmares, you're more irritated, and you're getting into arguments. So the truth about anxiety is that anxiety lies to you. It distorts the truth and it makes you think that the very thing that you're afraid of is actually going to happen. But the other part of it is that anxiety is never satisfied. It's never satiated, which means every time you feed it another anxious thought, it's like this greedy little monster that needs more. So it's always going to want more and more reassurance to the point where you're over reassuring the child. And our brain's job is to keep us alive and safe. But sometimes it gets too good at its job and it warns us of every possible danger because what if it happens? Which is, interestingly, a lot of people who've dealt with anxiety and OCD for most of their life, when this COVID stuff first started, many of them actually felt calm. And what I've heard from other therapists as well as from my own clients is that they're like, dude, I've prepared my whole life for the worst case scenario and now it's happening. When the rest of the world is now experiencing it, I'm like, I got this. I've been dealing with it. Now, I believe that may shift and change as things continue to get worse and as we continue to be in isolation and self-quarantine, because maybe then that rising of the anxiety that has fallen may start to rise again because things aren't getting better like they're supposed to. The thing is, anxiety is very common. It tends to be very much genetic, which means it can be passed on within families, but it's also very much environmental and learned, which means we learn from our parents, from our families, from people around us to be anxious. But the good news is that because anxiety is learned, it can be unlearned. So let me give you a few quick tips here. Therapy can be very effective for anxiety for many reasons. One is because it teaches you the skills you need. Cognitive behavioral therapy is one because it teaches you to address your thoughts, your behaviors, and your emotions. It teaches you how to do things differently, like opposite action, so that you can tackle the anxiety from a different perspective. Acceptance and commitment therapy is another way to address anxiety. It's another type of therapeutic intervention. And then exposure and response prevention is another one. And that is one that's really great for obsessive compulsive disorder because it teaches you how to face something and then not to avoid it. Parent coaching can be extremely effective. Many times kids don't even need to be seen for their anxiety. Just the parent being seen can be effective because as the parent, as you learn how to deal with your own anxiety, then you can also help your child deal with that. Many families I find that when the child has anxiety, the parent also does too. And the other thing too is helping that child build their feeling vocabulary, which basically means giving them the words to use besides things like anxious and worried. Because as they do that, they can better learn how to deal with their own anxiety. So I hope this has been really helpful for you. This is just a few quick tips. It's so much more complicated in terms of getting into it and really giving you much more specific strategies. But this is a really great start. Is helping to know, don't feed the fear, don't give it legs, coaching yourself through it, and then giving your child a feeling vocabulary. The bottom line is help them to face their fears. I wish you the best. Stay safe and stay home. I'm Dr. Ann-Louise Lockhart.